Chronic traumatic encephalopathy, also known as CTE, is a disorder that is receiving increasing attention due to its link to chronic head trauma, especially in sports and military settings. It is a degenerative neurological condition marked by cognitive deterioration, mood swings, and behavioral disturbances. Recognizing CTE's consequences is critical as it highlights the long-term impact of brain trauma and emphasizes the importance of prevention measures and appropriate management tactics. This animation will present the biological causes and symptoms of CTE, providing a comprehensive explanation. By using examples from athletes, deeper insight into this condition will be explored.
The main symptoms of CTE are behavioral and mood changes, decrease in cognitive functioning, amnesia, and motor dysfunction. Differentiating the mood and behavioral symptoms from conditions like depression, anxiety, mental health disorders, and post-concussion syndrome can be challenging. Similarly, the decrease in cognition shares similarities with Alzheimer's disease. However, at times, CTE can be asymptomatic. The symptoms vary across ages. In younger patients, mood and behavior symptoms are more prevalent, whereas older adults experience cognitive impairment and executive dysfunction more frequently. Furthermore, due to CTE being impossible to diagnose while the individual is alive, clinicians will look for traumatic encephalopathy syndrome. TES is a clinical syndrome characterized by symptoms endured by individuals throughout their lives, which may indicate the presence of CTE. According to NINDS consensus diagnostic criteria for TES, the main clinical criteria are significant exposure to repetitive head injuries, key signs of memory or thinking problems, or emotional and behavioral issues that worsen over time, and symptoms not fully explained by other conditions. If someone meets the first three criteria, their level of functional dependence and dementia severity is assessed, ranging from independent to severe. It is critical to realize that the symptoms of CTE might be similar to those of other neurodegenerative diseases and mental health disorders, making identification challenging, especially while the individual is alive. Furthermore, symptoms may develop years or even decades after recurrent head traumas, increasing the difficulty of diagnosis and therapy.
Aaron Hernandez was a 27-year-old professional American football player. Hernandez began playing football at 8 years old until he was charged with murder in 2013. Throughout his life, he was known as an all-star player with aggressive tendencies. Teammates of Hernandez would describe him as being prone to severe mood swings on and off the field. Hernandez also had frequent run-ins with law enforcement up until his death. He died by suicide in his prison cell in 2017, 2 years into serving his sentence for first-degree murder of his friend Odin Lloyd. It is said that Lloyd and Hernandez had gotten into a minor disagreement due to Hernandez acting paranoid over a conversation he had had previously. There was ongoing speculation as to what caused Hernandez to act in such erratic and violent ways. However, soon after his death, Hernandez's family donated his brain to Boston University to be studied, where researchers diagnosed him with stage 3 CTE. Researchers had described it as the most severe case of CTE medically seen in a person of his age. The damage caused to Hernandez's brain, personality, and behavior can be linked to years of repeated head trauma from playing football. Rick Martin was a Hall of Fame professional Canadian hockey player who played in the NHL for 11 years. Before hanging up his skates, Martin had gotten into one of the most dangerous injuries in NHL history. Martin was tripped by a player from behind him during one of his games, causing him to hit his head straight on ice. Martin went unconscious immediately and started convulsing. This incident caused the only major concussion that Martin was ever recorded to have. Martin also rarely got into physical altercations on the ice and off the ice. The concussion was said to have had little effect on his abilities or behavior. However, in 2011, Martin died of heart failure at 59 years old, and later analysis of his brain revealed that he had stage 2 CTE. Researchers described the disorder as mild, but suggested that the disease would have progressed had he lived longer. There was also a high probability that he would have developed dementia. The damage caused to Martin's brain is said to have had stemmed from the single blow to his head during hockey.
If you want to look at CTE from a biological viewpoint, we face terms such as tau proteins, p-tau, and tauopathies. So to begin with, tau proteins are proteins found with microtubules which specifically assist the polymerization and stabilization of the tubulins into microtubules. Additionally, further studies of these proteins and its association with certain disorders lead to the term tauopathy, characterized by the excess amount of abnormal and hyperphosphorylated tau protein in the brain, is about disorders that tau protein and its tendency to act in a certain way, which in our case is phosphorylation, is the main feature. The phosphorylation of these proteins normally is a regulation factor to their binding to microtubules, but if there is hyperphosphorylation in protein, which is known as p-tau, depending on the brain region and location of these abnormal proteins, several tauopathies can occur. For example, aging-related astrogliopathy or RTOC, Alzheimer's disease, chronic traumatic encephalopathy or CTE, and primary age-related tauopathy, and etc., many others. Now in our case, CTE again, a type of tauopathy, it is associated itself with another tauopathy called neurofibrillary tangles or NFTs, which can be defined as abnormal buildup of tau proteins found in layer 2 and upper third of layer 3 of neocortical areas of brain in a denser pattern than Alzheimer's cases. In addition, a type of astrocytes involving blood-brain barrier called tau immunoreactive protoplasmic astrocytes, and here immunoreactive means it can be identified with certain antibodies. So these astrocytes can be observed in top areas of the cortex in plaque-formed clusters created from spherical neurites. And neurites here means dendrites and axons. So without going into further details due to the amount of time left, we can conclude that CTE traits, such as micropathological ones mentioned, as well as several others like neural loss in specific regions and many others, they would differentiate CTE from other tauopathies such as the examples mentioned.
In conclusion, chronic traumatic encephalopathy is a serious consequence of repeated or major head injuries. This condition, characterized by cognitive decline and behavioral changes, often remains hidden for years, making diagnosis and treatment challenging. The stories of individuals like Aryan Hernandez and Rick Martin vividly illustrate the devastating impact of CTE on people's lives. Biologically, CTE is identified by the accumulation of tau proteins and neurofibrillary tangles in the brain. Moving forward, prioritizing prevention and increasing awareness can help mitigate the long-term effects of CTE, underscoring the importance of proactive measures to protect brain health. Since CTE's diagnosis typically occurs post-mortem, there aren't direct means of prevention or treatment for individuals already affected. However, increasing awareness can still be vital in alleviating the long-term impact of CTE on society as a whole. By advocating for safer practices in sports and other activities prone to head injuries, implementing proper concussion protocols, and educating individuals on the risks associated with repetitive head trauma, we can potentially reduce the incidence of CTE in future generations. Thank you for listening.